today's topic is one of my favorites, all right? Because I pay a huge tribute and give a lot of appreciation and a lot of attention to caregivers. And why do you think that is? They're a big help. It goes way beyond that. The dynamics of caregiving, I could write a novel on it. You know, the effect of having someone that you love, someone that makes up half of you, if not more, the love of your life, you know, has a disease, has a disability, has a difficulty, has a challenge. And that, my friends, is one of the most painful things there is. Does anybody want to disagree with that? It's very difficult to see someone that you love. And please remember, when you're a caregiver, that the person that you're caring for is at arm's length, I call it. You know, right here, not by default. They're not there by accident. Why are they there? They're there because they are a precious part of you. Anybody want to disagree? The person that you're loving on, the person that you're helping, makes you whole. Makes you whole. Identifies you. Think about, this is where I see the pats come in. I just love this perch because I see the pats and the wax and that kind of stuff up here, okay? Picture your life without that precious human being. Right? Now, is it a cakewalk? Is it easy?
No.
How did it happen, my caregivers? Did you stand in line? Did you stand in line as a retired senior or anybody at any age and say, pick me, pick me, pick me. I want to be a caregiver. Please pick me. I'm right out front and center. Gotta pick me. I want to do this for the rest of my life. How many of you did that?
I'll tell you how you got married.
There's always a smarty pants in here. The day you got married, was that last month, last week? How many?
45 years.
45 years? Congratulations, you're very fortunate. 45 years, that's a huge commitment, because good marriages, you care for each other, right? Good relationships, good partnerships, it's all about the loving commitment, not the piece of paper. That's where I come from. And it's easy. I always think that, you know, caring for someone that you love is a privilege. A lot of times people feel like, oh, I'm so tired, it's so monotonous, it's so boring, I have no life, I've given up everything, there's no end in sight, la 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 la, and I'm telling you, they can talk me into next Tuesday with the negativity. But through my eyes, and just by witnessing and walking with a lot of sensational caregivers, it's a privilege. Who could do it better than you? Who would you want doing it other than you? Oh, I shouldn't throw that one out there. I set myself at risk and I sit here and count to 3 waiting for something. Am I right? It always amazes me that beautiful marriages, beautiful partnerships, beautiful friendships, you know, and I've seen this equally because I'm not sure, but I think I might have a couple, you know, professional caregivers in here. And, you know, if you're in healthcare, it's the greatest business to ever be in, but we really love you, right? I have any professional caregivers in here? I know, and I watch you. I can pick you out. You can tell me, oh, I'm his son. I know better. All right? You don't have to have a ticket on with me. But we really get to love you, right? We really care about you. We want you to have the best. So even these people have a huge commitment, you know, to you. But the thing is, it's very difficult. It's very hard. The dilemma, the dynamics of it is very, very, very difficult. And if you don't find the right way to do it, it can really bring you down. Parkinson's disease, it's chronic, it's degenerative, it's neurological, all right? So you're running a marathon, not a sprint. You notice that? You know, it's easy to run a sprint. I had a gator get out of my lake once. You know they go faster than a racehorse in the first 40 feet? That little guy, he got out of my lake and he ran. I couldn't believe it was a gator. They got long legs. Did you know that?
That's why I have to run.
And I was so grateful he was running away from me. So anyway, so back to my story, and I'm right on it here. You're running a marathon, not a sprint. This is long term. It's long time strength and endurance for the caregiver. So that means you gotta pace. You gotta pace. What's the number one priority? You. You come first. My caregivers, you gotta pay attention to, are you eating, are you sleeping, are you having time for yourself, are you doing stress management, are you feeling healthy, okay? Are you enjoying life? Are you maintaining a positive attitude and some optimism? Because guess what, and I'm gonna tell you this, but you can't give away what you haven't got. So if your goal, and I know my goal is to make a positive life, a positive contribution in the lives of people that I love, right? So you can't do it if you haven't got it. So if you're stressed, depressed, and out of control, you're going to only make things worse. So you come first. Just like when you're on the plane, does mommy put the mask on baby first? Why do you think that is?
So mommy doesn't pass out.
Because if mommy's out cold, nothing happens. So I want you to, when you listen to me, and I want you, this is the number one rule of caregiving. Top priority is you. And if you want to put it in full perspective, think about your loved one's life without you in it. How many of you have got a backup band? How many of you got a line of people standing behind you saying, well, you know, if you conk out or quit, get sick, I'm right here. Not going to miss a beat, I'm going to come right in and do it for you. Just like the people stand by, you know, want your seat, right, in the airplane. How many of you got a full backup band, stand in the line, begging to do your job? Anybody? You know. Okay, so you have to take good care of yourself. Now, please understand that the relationship between the patient and the caregiver in Parkinson's disease, and in any disease, it's a partnership. Do you hear me? You caregivers, you are not wait staff, right? You are not chief cook and bottle washer. You're not the do-it-all. And you beautiful Parkinson patients, because you have Parkinson's disease, you're not off the hook. You do not have the right to get in a recliner with the clicker and stay there. What are your responsibilities to your caregiver?
To help out.
To help out. Will knows. Anything that you can do for yourself or your loved one, you are to do it. How many of you can say to me, I'm giving up my best shot? As long as you're trying. And you're going to have good days, you're going to have bad days. You're going to have good hours, you're going to have bad hours. All right? And there's times when we have to let you off the hook. We know that. There's times that your Parkinson body is not going to allow you to do as much as maybe you were hoping that you would be able to do to help out. Just try. All right? And do a lot of the little things. And the things that you can do for yourself, the number one thing that I encourage Parkinson patients to do because the more you do for yourself, the more under control you feel. Do you hear me? The more you do for yourself, the more under control that you feel. The human spirit likes to be independent. We've been groomed and raised to be independent. Our accomplishments matter to us. It has to do with who we are. It has to do with our identity. So we really like to be able to have the independence of getting up, caring for ourselves, doing what we want to do. Well, with Parkinson's disease, sometimes we have more difficulty with that because of the functional loss, the dexterity, the weakness. You just can't do it. Does this mean you caregivers step in and do everything for your loved one? Oh, I see it's a little hard for you, honey buddy, so just let me take care of you from now till the end of time. You'll never have to button another button. Is that it? No. It certainly most assuredly is not. This is the other component with Parkinson caregiving. Your need to promote and to motivate is exhausting. Right? It is exhausting. Because you know in your heart, they're going to feel better about themselves if they're able to button a button or to brush their teeth or, you know, to don their shoes or whatever. You know that. You know it's a lot easier on you and on him if you do it. Right? And the ability to motivate, to encourage somebody to do for themselves, it's good for you physically to keep moving. It's good for you emotionally because you have a sense of esteem and independence. And that's the tough component of it. When to help, when not to help, when to stop motivating, when to step in, when to remind them about the meds, when to take over the meds, right? It's a constant adventure. So what is the solution? You patients, you know, I want you to take ownership in your life. Whose life is it? You just happen to be a human being, a wonderful human being that just so happens to have Parkinson's disease. You still own your life. You own your life until your last breath. Got it? So you want to ask for help when necessary, and you want to help your caregiver to realize when to help and when not to help. And this is an evolution as we go through the stages of the disease. You're going to notice, like in the beginning, everybody's doing fine, you can do with whatever. And the other thing to understand is there's no cookie cut for this because there's no two Parkinson patients the same. A lot of you will say to me, gee whiz, Marilyn, if I'm like this today, what am I going to be with like next month, 6 months, and a year, and 2 years? I have no idea. Nobody has any idea. Neither does your doctor. That's up to you and how you choose to respond to your medications, how your brain chooses to respond to the disease, and how much intervention and prevention you're doing by being aggressive with your treatment of keeping yourself on the highest level. All right? So you patients, your esteem matters. Your ability to do for yourself matters. So do for yourself and ask for help when you want it. Now your caregivers need to sit back a little bit. You need to give them the time and the opportunity to do for themselves. How many of you are doing that? It's not an act of love to do too much or to impose. It's not. You're hurting them. I hate to use that word to caregivers, but you're not enabling them to be their best. So you patients, you know, if you know you can do it, you just have to say, you know, just give me an extra 15 minutes, just let me take my time and I'll pull this off. You know, go have a cup of coffee or something like that. You hear it? It's a work in progress. But don't automatically jump in and say, I'll do this for you, I'm fixing this for you. And once again, it's all about choices. I mean, how many of you women, you know, want him putting on your makeup? Mm-hmm. Huh? How many of you men want somebody shaving your face? Huh?
With the razor, it's okay, but not with a blade.
And you only hand Margot a straight edge, huh? Okay, I'm with you. The key, what?
I allow my nurse to use the straight razor.
Ratchet does his face.
That's Ratchet. I used to be terrified when I was a real nurse. I was like, oh my God, I'm not good at that stuff. So find a happy medium of I want to do for myself, let me know when you want me to help. You offer up the choices. Lots of times caregivers, we can become, usually really good caregivers are A personalities. We're control freaks, right? We are freaking control freaks. I got it all figured out. We're going to do it my way. It's going to be fun, fast, and easy. Bada bing, bada bum. I did it. The biggest mistake I made. All right. I teach caregiving because when I did it for 4 years, I did everything wrong. It's true, Katie. I did everything wrong, and I was an RN, and I had a lot of experience, and a very good CV in nursing, but when it came time to take care of Kenny Bob, I made every single mistake. So now everything that I did, I just flip it over and teach you the opposite. Simple. Simple. Yeah, Con.
Please and thank yous.
Please and thanks, yeah. That's the one thing with caregiving, because this is all about a relationship. It's a It's a give and take loving partnership, which is what every single relationship is. And it's based on understanding and respect, and it needs to be dignified and caring and kind and patient and all the things that we're taught that love is. But in the role of caregiving, it can be very difficult. It can really, really test you. You can become very tired, very impatient, very intolerant, right? You can flip. A lot of times it's very difficult for caregivers because, you know, now you need to do twice as much in half the time. You notice that? Sometimes your loved one can't do some things that they used to do, or they need more attention, more time, more commitment from you. A lot of times they can't do for you. We all know in a relationship it's a give and take, and it's always lovely to have somebody do something for you once in a while, right? No matter who you are. And sometimes with this disease they have days or they have times that they're not able to do for you. They're not able to do the things that in their heart they would love to do because their body won't allow them to do it. But that is when you kick into the greatest support and the greatest help that you can give, and that is verbal. That is verbal. You know, the thank you, the please, the positive affirmations. You know, I love you, I care about you, what can I do for you? I can see you're upset, let me listen. You see what I'm saying? The ability to reach out and give a support, an emotional support, even if you can't clean the garage and mow the grass or cook the turkey dinner. Who cares? You see what I'm saying? You don't lose the ability to maintain your half of the relationship. Now, with some Parkinson patients, as they get older, and I blame a lot of it on getting older, as well as getting older with Parkinson's, but sometimes the day comes that their days of helping you are over. All right? This happens to some families. Okay? So you just graciously say, okay, your days of helping me are over. Right? I can't do it anymore. So you continue to hold hands and love each other and talk to each other. All right? Because what you need to do to help and support each other doesn't take energy, it doesn't take money, it doesn't take time, it doesn't take anything. It's just the simple, thank you, please, I love you, I appreciate you, what can I do to help you? Little things like, you know, you seem tired to me, why don't you just go to the spa or walk the beach or whatever you know your loved one wants to do. Your patients are responsible for your caregiver. You are responsible for them. This is the greatest gift in your life. They are more important than your physicians, than me, than anybody else in your life. How many of you disagree with me? Good. They are more important than anything else. And you need to care for them. You need to support them. You need to hold them up. If only by words and even pats and hugs and this kind of stuff. You got it? You're not off the hook. And they have given up, really, what is the definition of a caregiver? This ought to be good, because I have my own. You know, I have my own everything, so. What is a caregiver? I mean, if you really wanted to define it.
Your best friend.
Your best friend. I like that word, friend. That's right. You know, your best friend, your buddy. You know, the person that's right there, thick or thin, rain or shine. Through me, caregiving is a selfless act of love. Where's that word? What are you doing and why are you doing it, caregivers? What's the bond? Love. Love. Favorite subject is love. You love them. Right? Can't stop love, can't make it happen. Have you noticed that? You ever think about that? I'm trying to love you, but I just can't get myself to do it. And if I love you, you're stuck with me. All right? It's a selfless act of love. That means that the person you are caring for, you put before yourself. And I can't think of a more precious gift. So you caregivers, You've earned your star in heaven, right? But it's not a job, it's not a discipline, it's not a punishment. You need to flip it around to, I'm doing what I'm doing because I want to do it, because I love this human being, this is my life. You want to think about, if you want to put things in perspective, all right, what would you do with your time if you had an overabundance of it? Where would you go if you could go anywhere in the world? Just get up and go. All right? Right where you are. Who would you spend your time with if you didn't have the person with you that you could spend your time? What would you be doing? You ever think about that? So sometimes you're so stuck in the moment that you want to get out. But be careful what you wish for, because once you get out, you're going to want to go right back in again, and it's a one-way ticket out. Right? You know? It's a one-way ticket. So think about that. All right? And think about the beautiful relationship that you have today. So you need to work together, and you need to focus on, I have a great life today. You choose to take control. You choose to be empowered. You choose to believe in yourself and in your life. How many of you think you have worth? Oh, I'm glad to see your hand go up that fast. You should be popping those hands up so fast, it should be the fastest thing you've done all day. Huh? How many of you have self-worth? If you don't, I'm going to do a 3-part series on self-worth. Huh? Self-worth. What is more precious than your life? What is more important than you? You're here for a reason. You got to figure out what it is. But you're here for a reason. You're worthwhile. You make a difference. You make a difference in the world around you. What do you do in the course of the day to make the world a better place? This is your exercise every day. It can be the simplest, kindest, smallest thing. What do?
Stay out of the kitchen.
Oh, there you go. Stay out of the kitchen. Okay. There you are. Stay out of the kitchen. He makes your life a lot better, doesn't he?
Little kitchen, he won't fit.
Oh, he won't. Okay. I thought he was giving you the privacy of your, whatever you do in your kitchen. He's too fat to fit in. That's the real reason.
Oh, narrow galley kitchen.
My Nana used to have one of them,
Two
too.
people in there.
Claustrophobia, right? Right. My grandmother used to have one of them, one way in and one way out. She could stand here and do everything, but boy, did she put, it was long and thin, boy. What, she couldn't pump out the food, you know? So what's the key to maintaining a positive patient-caregiver relationship? What's the key for you? Understanding. True, great word. I love that word, understanding. Because we all need to be understood. And if you want to understand, this is another exercise that I can give you on days that you're not as positive or perky as you think you should be, either the patient or the caregiver. And you do what I always taught in healthcare, you know, get behind the eyes of the person that you're caring for. Get behind the eyes of the person that you're sharing your life with. That's the only way that you can truly understand. You have to have the ability to understand, or to try to understand, try to reason what they're living with, what they're doing, what they're dealing with, what they're thinking. You caregivers, when you want to kill them, I couldn't hold it in. You know those days? You know? You want a one-way ticket to somewhere. I used to say, beam me up, Scotty. Just get me out of wherever I am. This would be a good time. You just go behind their eyes. What are they thinking? What are they feeling? What is it like to live with Parkinson's disease? And you caregivers, I don't care, and you patients, I don't care if you can't communicate, or, you know, if you don't care to communicate, you know, get behind the eyes of your caregiver and simply say, what must it be like for her or for him? Got me? It's the fastest thing I can give you to do to get you on the road that you need to be on to move forward on a positive note. And this is what it's all about. A better life today starts with your positive attitude, with your positive choices, with your positive relationship with your caregiver. And all of this is in your control. You understand me? All of this is in your control. You can live the greatest life with Parkinson's. You can have a greater quality of life. You can have more hope and more happiness with this disease than some people can have without it. I've seen it. I see it every day. You understand me? So hold on to your happiness. Hold on to your hope. Hold on to each other. Okay?